A major change is happening in baby health, one that could impact millions of families across the country and shape the way we think about protecting our youngest citizens. This development is sparking a heated national debate, with passionate voices on all sides weighing in. On December 5, 2025, the CDC's Advisory Committee on Immunization Practices, known as ACIP, voted to reverse the long-standing rule of giving every newborn the hepatitis B vaccine within 24 hours of birth, a policy that's been in place for decades. This change isn't official just yet. It still needs the CDC director's final approval. But even so, it signals a dramatic and potentially controversial shift in public health policy that could have far-reaching effects. The decision has strong support from President Trump and some political leaders, who argue it's a step toward more parental choice and less government overreach. But many doctors, pediatricians, and public health experts are deeply concerned, warning that this move could put vulnerable infants at risk and undermine decades of progress in disease prevention. This isn't just a medical update, it's a policy that touches on science, personal beliefs, and politics, igniting fierce arguments about what's best for children and society as a whole. In this video, we'll break down what hepatitis B is, how it spreads, and why it's been a focus of childhood vaccination for so long. We'll explore why the old rule existed in the first place, and what experts hope to achieve by vaccinating all newborns. And we'll look at the reasons behind this new policy, including the arguments for targeting only certain babies for vaccination at birth. We'll hear from both supporters, who believe this change empowers parents and respects individual choice, and critics of the change, who fear it could open the door to preventable outbreaks and put newborns at unnecessary risk. The debate over the hepatitis B vaccine for newborns affects families making tough decisions, doctors on the front lines of care, and the health of our communities, as we all work to keep children safe and healthy. It raises important questions about balancing individual choice with public health, and how much say the government should have in our medical decisions. From the White House to hospitals, people everywhere are weighing in on what's best for babies, and what this change could mean for the future. Let's dive into the details together, so you can understand what this bold move could mean for the future of public health in America, and for families like yours. Stay tuned as we explore all sides of this critical issue, and help you make sense of the facts, the fears, and the future of newborn health policy. Before we talk about vaccines, let's take a moment to understand what hepatitis B really is and why it's such a big concern, especially for newborn babies and their families. Hepatitis B is a serious infection of the liver, caused by the hepatitis B virus. This virus attacks the liver and can lead to lifelong health problems, including cirrhosis, liver cancer, and even death if left untreated. It's a global health issue, affecting millions of people around the world. For newborns, the risk is especially high. If a baby is infected at birth, about 90% will develop a chronic, lifelong infection. Unlike adults, babies' immune systems are not strong enough to clear the virus on their own. The main way babies get hepatitis B is from their mothers during childbirth. This can happen even if the mother doesn't know she's infected, since hepatitis B often has no symptoms. This is called perinatal transmission, and it's the reason why health organizations around the world recommend vaccinating newborns as soon as possible after birth. While adults can get hepatitis B through sexual contact, sharing needles, or other blood exposures, the real danger for babies is this silent, mother-to-child transmission at birth. A newborn's immune system is still developing and can't fight off the virus effectively. That's why early vaccination, ideally within the first 24 hours of life, is absolutely crucial to protect them. Chronic hepatitis B infection can silently damage the liver for years, even decades, before any symptoms appear. By then, the liver may already be severely scarred or cancerous. By the time someone finally feels sick, the damage may be irreversible, and treatment options become much more limited. That's why public health experts call the hepatitis B vaccine the world's first anti-cancer vaccine for children. It prevents not just infection, but also the cancers and complications that can come years later. It's a powerful tool to prevent a lifetime of suffering, giving children the chance to grow up healthy and free from this hidden threat. For newborns and their families, the stakes couldn't be higher. Early protection can truly make all the difference. For decades, the U.S. followed a universal policy. Every newborn received the hepatitis B vaccine within 24 hours of birth, no matter their background or risk factors. This was a bold, sweeping approach, designed to leave no baby unprotected from a silent but dangerous threat. This approach created a safety net, protecting all babies, regardless of their mother's health status or whether risk factors were known. It meant that every child from every family had the same shield against hepatitis B from their very first day. The reason? Testing isn't perfect. Sometimes results are wrong or unavailable, and mothers can get infected late in pregnancy, even after initial tests. There are gaps in the system, and mistakes can happen, sometimes with lifelong consequences for the baby. Universal vaccination ensured no baby slipped through the cracks. It was a simple, effective way to guarantee protection for every newborn, regardless of circumstance. Before this policy, thousands of babies were infected each year, facing a future of liver disease and cancer. The consequences were devastating, not just for families, but for entire communities. The birth dose policy changed that, dramatically reducing infections and giving countless children a healthier start in life. The process was simple. A nurse gave the first of 3 shots after birth, right in the hospital, before the baby went home. The next doses were given at later checkups, building strong, lasting immunity as the child grew. This became a cornerstone of pediatric care and was celebrated as a major public health success, saving lives and preventing suffering for an entire generation. Now, this policy has been reversed, igniting debate about the best way to protect our children. Experts, parents, and doctors are all weighing in, concerned about what this change could mean. The question, is it time to change what's worked for a generation, or are we risking the health of our most vulnerable by moving away from a proven strategy? As we reconsider this policy, we must ask, are we truly prepared for the consequences, or are we risking a return to a past we worked so hard to leave behind? The new CDC guidance marks a major shift. Instead of vaccinating all newborns, only babies born to mothers who test positive for hepatitis B would get the vaccine within 24 hours. For most babies, the first dose would be delayed until their 1 or 2 month checkup. This ends the universal birth dose policy and creates a 2-tiered system. Supporters argue that if a mother tests negative, her baby isn't at risk and the vaccine can wait. They see this as reducing unnecessary medical interventions for healthy newborns. But the new system relies entirely on accurate, timely test results. If there's an error or delay, a high-risk baby could miss the critical window for protection. Opponents warn this removes the safety net that's protected babies for decades. The debate centers on whether targeted vaccination is safer or riskier than universal coverage. Is this a smart update or a dangerous gamble? The stakes are high for every newborn. President Trump and his administration have championed this new policy. Trump calls the old universal policy ridiculous, arguing most newborns aren't at risk and shouldn't get unnecessary shots. He emphasizes that hepatitis B is mainly spread among adults, not babies. The administration's philosophy limits medical interventions to those truly at risk. HHS Secretary Robert F. Kennedy Jr., a longtime vaccine skeptic, has reshaped the CDC's advisory committee to reflect this view. Trump recently ordered a review of the U.S. vaccine schedule, claiming American babies get more shots than those in other countries. Supporters say this change empowers parents and reduces the burden on newborns. They argue the old policy was a one-size-fits-all approach, not tailored to individual risk. The administration frames this as a move toward a safer, more reasonable vaccine schedule. Critics, however, see it as a step backward for public health. The medical community is pushing back, hard. Leading doctors and public health experts warn that ending universal vaccination could undo decades of progress. They argue the old policy worked because it was simple and foolproof. The new system depends on perfect testing and communication, rare in busy hospitals. If a mother's infection is missed, her baby could face lifelong illness. The hepatitis B vaccine has a long proven safety record, with serious side effects extremely rare. For doctors, the benefits of universal vaccination far outweigh the risks. Major organizations like the American Academy of Pediatrics are urging policymakers to reconsider. They fear a preventable resurgence of hepatitis B in children. The numbers tell the story. Before universal vaccination in the early 1990s, about 20,000 U.S. babies were infected with hepatitis B each year. After the policy, that number dropped to fewer than 20, a 99% reduction. Critics of the new guidance say these statistics are a warning. They argue the low numbers prove the policy works, and abandoning it risks a resurgence. Even a small increase in cases means more children with lifelong preventable disease. Supporters of the change see the low numbers as proof the threat is gone. Opponents say the threat is only contained by the current policy. The vaccine is the wall holding the virus back. Remove it and cracks may appear. For many, the data is a clear reason to keep universal vaccination. The stakes are measured in lives saved. The debate has reached Congress. Senator Bill Cassidy, a physician and Republican, is a leading critic of the new policy. He calls the change a mistake that will make America sicker. As chair of the Senate Health Committee, Cassidy urges the CDC to keep the universal policy. He argues that the science is clear: universal vaccination is the safest, most effective way to protect newborns. Cassidy warns that a more complicated system will fail vulnerable babies. His stance shows this isn't just a partisan issue, it's about evidence and experience. Cassidy's message: stick with what works, and don't risk a deadly resurgence. He's sounding the alarm for policymakers to listen to the science. As of December 6, 2025, the future of the hepatitis B birth dose policy hangs in the balance. The CDC director must decide, follow the advisory committee and Trump administration, or heed warnings from doctors and keep the universal policy. If the new guidance is adopted, hospitals will switch to the two-tiered system, and supporters will claim a victory for parental choice. The medical community, however, will be watching for any rise in newborn infections. If the policy is rejected, it will be a win for public health advocates and a challenge to the administration. Either way, this debate has put childhood immunizations in the national spotlight. It highlights the tension between politics, science, and personal beliefs. The decisions made now will shape the health of the next generation. Whether we stick with universal prevention or try targeted vaccination, the consequences will be lasting. The world is watching to see which path America chooses.